what is wrong with this baby.
We're starting to think that it was more of a psychological problem with her.
I think my husband and I cried all night long.
I see my mom, I see my brother, and I see my kids.
She would go to every single branch of science available to try to figure out what was wrong with her, and she could never find anything.
Tonight, 2 medical mysteries and the doctors that solved them. Judy Goltz was suffering from a life-threatening illness. She knew she was sick, but the experts couldn't find anything wrong with her.
I was so desperate. I even had him test me for AIDS. I was grasping for straws.
Next, for 3 years, Mary and Rich Jordan felt completely helpless as they watched their young son's unquenchable thirst slowly destroy him and their family.
We'd seen so many doctors by then, and they all told us he was fine. And I wanted to believe that.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery.
Mary and Rich Jordan's daughter was 4 when they decided to expand the family and adopt newborn fraternal twin boys.
The babies were born and placed into our arms, and I can't explain how it felt. It was amazing.
Joey was actually the larger of the 2. He was 7 pounds, and Patrick was 6 pounds and 2 ounces, I think. What you picture in your mind of a big baby, they had the roles of little tiny sumo wrestlers, they're just, tanks.
But despite their physical similarities, the twins begin to exhibit very different personalities.
Patrick was quiet, just kind of went with the flow. Joey, even from birth, would cry a lot.
Joe wanted food, he wanted his bottle. He wanted to be fed right away. And he would just suck on the bottle, and then, you'd have to pop it out of his mouth and get him to breathe for a second, and he would just go, and then he'd grab the bottle again and stuff it back in his mouth.
And he'd finish that bottle within a couple of minutes, and then he'd just projectile it out. You would just drape yourself with blankets because you knew the minute you fed him, he was going to vomit all over you.
41-year-old Judy Goltz is a mother of 2 and a registered nurse.
I was feeling a little bit run down. It was October, and I kind of felt a little flu-like. And I woke up that morning, and I went to the bathroom, and I passed a burgundy-colored stool. My nursing instincts and training told me it was blood, but I wasn't really quite sure.
Worried, Judy rushed to the emergency room.
I went down and met her there. They had done several tests, blood tests, and they never really found anything.
He said to me, "I'm sure this is an infection. Here's an antibiotic. Come in in a couple of days when the bleeding stops, and we'll do a colonoscopy."
The boys' pediatrician tells them not to worry. Joey's still eating, gaining weight, and seems healthy. But as time goes by, he gets worse.
He always cried at night, and it got really annoying, and it kept everyone up. And he was always thirsty and always hungry.
There were nights that I'd have to roll Joey's crib out into another room so that Patrick can sleep, because Patrick was sleeping through the night, and I didn't want Joey to wake up Patrick.
He would make a big racket that would wake up Patrick. Patrick is figuring, well, while I'm awake, I might as well have something to eat too. So we would both end up sitting there, and we'd be feeding them at the same time. And whoever had Joe would always get done first. They would have to deal with the throw up, but they would get to go back to bed quicker than the other one.
5 days later, a colonoscopy showed nothing. It appeared that if it was an infection, it had cleared up.
The bleeding had stopped, so I felt that okay, I'm fine. It was a one-time episode.
She's young, and she appears very healthy. You think, okay, it was just a polyp of some sort or a hemorrhoid. So we didn't pay too much attention. At least I didn't pay as much attention.
But as the months went on, Judy began to feel worse and worse.
I caught everything. I was probably sick every 3 months with a cold, a flu, urinary tract infections, everything. I just was constantly ill. I started to put on weight. Over a period of 5 years, I put on almost 30 pounds.
I thought it was just part of her getting a little bit older, taking care of the kids more than she's taking care of herself.
One of the other things that I was experiencing at that time was what I call a type of mental fog. I would just feel like sometimes I was thinking through a haze.
I thought she's a young mom. She's running. I thought maybe she was just tiring herself out.
I knew something was wrong with me, and I was not going to give up until I found out what it was. So I went to an endocrinologist. Actually, I went to two over a period of 5 years. I went to a rheumatologist. I went to, I have a shopping list of doctors. I went to a cardiologist and a vascular doctor.
She would go to every single branch of science available to try to figure out what was wrong with her. And she could never find anything.
Joey's appetite is a little strange, but in all other respects, he seems normal.
Everything about him was normal. As the first year was going on, he'd roll over when he was supposed to roll over. He'd babble when he was supposed to babble. He crawled when he was supposed to crawl. But I knew as a mother, something isn't right, but I couldn't put my hand on it.
Gradually, Mary begins to realize that it isn't just the amount of liquid going into Joey's body that's astounding.
We would have to change his diaper at least every 2 hours. A lot of times, I'd put a fresh diaper on him, and as I'm taping it up, he'd pee. And one time of peeing would fill the diaper.
And we would weigh him, and I kept a chart, how many ounces is that diaper, and wow, a new record. Kind of bizarre behavior, but we were being driven to extremes because the situation wasn't getting any better. It was actually getting worse.
When the twins are 6 months old, Mary takes the boys to a new pediatrician. But he doesn't think Joey's odd symptoms are anything out of the ordinary. On the contrary, the doctor tells Mary that she may be the one with the problem.
I went in and I said, he won't go to bed without a bottle. Well, don't give him the bottle. Let him cry himself to sleep. So I tried to put him to bed without the bottle. And he screamed, and he screamed, and he screamed. I'm surprised neighbors didn't come knocking on the door to see what is wrong with this baby, because you've never heard anything so loud and so horrible. And the doctors were saying that I needed to become tougher and let him do it, but I couldn't. I just couldn't. I gave in and gave him the bottle.
I think a lot of the doctors thought that Mary was nuts. This woman comes in, she's distraught, she's obviously, at the end of her rope. She's complaining about a child that pees too much and drinks too much and throws up. Come on, lady, just relax, take care of your kids.
December 1999, 4 years after the first episode, Judy hemorrhaged again.
Same type of episode happened where I was bleeding again.
Tests revealed Judy's red blood cell count was dangerously low.
They did a couple of procedures, had colonoscopy, upper endoscopy, gave me a lot of IVs. I was not allowed to eat or drink. They were resting my stomach. My doctor came in, again, was not concerned, said maybe an infection again, could be a polyp.
For 2 years, Joey has always eaten more and been bigger than Patrick. But suddenly, that pattern begins to change dramatically.
All of a sudden, we noticed that Patrick was outgrowing Joey. Patrick was the linebacker, and Joey was the petite one. Joey was getting Patrick's hand-me-downs. He stopped growing completely about age 2.
But again, the doctors would say, hey, sometimes that happens. Kids have growth spurts. So he's just at the end of a growth spurt.
We'd seen so many doctors by then, and they all told us he was fine. Even when he stopped growing, they said he was fine. And I wanted to believe that.
Over the next several months, Mary and Rich begin to notice another odd behavior.
He was very active, but he'd rather do things indoors. Did not like to be out in the bright sunlight that much without sunglasses. And we'd go through Batman sunglasses and Teletubby sunglasses and Barney sunglasses.
I thought he wanted attention because I was little and I wanted attention, and I thought he was trying to steal it from me.
And he would lick the back of his hand and then wipe his eyes, or we thought he was doing it to get moisture in his eyes.
Despite this peculiar reaction, Joey doesn't seem to be in any pain, and his vision checks out fine.
And so we just figured he was overly sensitive to the light, and his eyes were dried out because, there was just dry air.
The twins graduate from baby food and bottles, but Joey's taste in grown-up food seems a little bizarre.
Where most kids want candy, Joey wanted to eat salt. And we noticed he'd add salt to everything. No matter what it was, he'd put salt on it.
My sons would look at him and say, "Mom, what is he doing? It's already salty enough." And we would all sit there and just kind of go, "That's really disgusting." But he loved it.
I didn't think it was hugely odd. I thought maybe he had some bad taste buds or something like that. He just didn't get the idea or he liked the flavor of salt.
And if he didn't get the salt, he'd scream or cry. So we give in and kind of let him eat what he wanted to eat.
Judy was told not to worry, but for the next 2 years, her health continued to deteriorate. She began to panic.
I was so desperate. I even had him test me for AIDS, HIV. I just felt I was grasping for straws. I had been tested for lupus, for scleroderma. I had been tested for MS. I had been tested for all kinds of thyroid issues, and everything had come back negative.
I was starting to think that it was more of a psychological kind of problem with her.
It was just one story after the other, one illness after the other. I just said, enough, let's just stop this.
And I was at the point where I was starting to believe maybe it is me. Maybe everybody feels this way. Maybe it's normal to feel this way.
But in February 2001, 5 years after her first bleed, Judy experienced her most serious episode of bleeding yet. Her condition had become critical.
This time, I knew I'm getting an answer. This is absolutely ridiculous.
The twins are now 2.5, but the similarity ends there. Patrick has been sleeping through the night for months, while Joey is up 3 and 4 times a night screaming for water. Joey's problems are beginning to take a toll on the Jordans' lives.
Got to the point where we were both totally exhausted.
My husband and I were trying to take turns so that we'd at least get 3 to 4 hours sleep between us.
I don't think she got more than an hour's sleep for years.
And we kept going on the way we were. At 2.5, we were still up every hour or two taking care of him like he was a newborn baby. But nobody could tell us why.
Judy Goltz had been suffering from frightening bouts of bleeding. She had been told again and again that it was nothing to worry about. Then, she met Mount Sinai Hospital's Dr. Mark Reiner.
If a patient, any patient, has repeated problems and they're not receiving an adequate answer, then it's their right and in a certain way their duty to try to get the right answer.
Dr. Reiner recommended exploratory surgery.
He said, I'm going to open you up. I'm going to go through your intestines with a fine-tooth comb. He said, we'll go piece by piece by piece.
And he looked at it very confidently, and he said, if it is this big, I'll find it.
For 3 years, Mary and Rich Jordan have been dealing with their son Joey's bizarre symptoms: an unquenchable thirst, projectile vomiting, excessive urination, and an intense craving for salt. All along, the doctors have told them that he falls within the range of normal. Not satisfied, Mary Jordan takes Joey to yet another pediatrician, Dr. Michelle Ernst.
She was young and friendly. We went through the history of Joey, and she listened to me and didn't say it's your fault.
Mary's manner was one of a concerned mom. She knew something was definitely wrong with her son. When he was in the exam room, for a limited time, it was 15 or 20 minutes that I was with him, he had 4 cups of water in that small amount of time and got kind of antsy if his mom didn't give him water. And I thought, that's kind of peculiar. So it made me think something's probably not right here.
She then did a physical on him and asked, has Joey ever been tested for diabetes? And I said, no, he's never been tested for anything. And Dr. Ernst then said, that's the first thing we're going to do because excessive water drinking is a sign of diabetes.
Just a quick urine test that I did showed that there was potentially a problem.
At the hospital, Judy was prepped for surgery. As she lay in pre-op waiting, she had one request for Mike.
She said, you have to promise me, whatever it is, you come down to the recovery room and tell me. She said, promise. So I said, I promise you. I gave her a kiss and they wheeled her off, and I just went back and waited in her room for her to come up.
When I first put the laparoscope in, the first thing you do is look around and explore the abdomen visually before touching anything. I looked at her in the pelvis to look at her ovaries. These were completely normal, as was her uterus. I looked at the liver and gallbladder, which were normal, and I explored her colon, which was also completely normal.
Dr. Reiner's last words to me were saying, Mike, listen, it's about a 3-hour surgery. The longer I'm in there, that means I can't find anything. So I looked at my watch and said, wow, 3.5 hours, he didn't find anything.
I then decided to run the small bowel, which is where I thought the problem was.
And 15 minutes later, Dr. Reiner comes in, and he claps his hand, and he shakes his hands and says, hey, Mike, I found the cause of your wife's bleeds. Kind of nonchalant, and I said, oh, great, what was it? He goes, sit down. And I remember I got chills completely all over my body. I said, what? He said, I need you to sit down. And that's when he told me that he had found a tumor, a malignant tumor, that had got into her lymph system.
The urinalysis shows that Joey doesn't have juvenile diabetes, but he does have abnormally high levels of sugar and protein in his urine, an indication that there is something wrong with his kidneys.
I knew something was wrong with my child, and she's finally saying there's something wrong with my child.
Dr. Ernst refers them to pediatric kidney specialist Dr. Sheldon Orloff to investigate.
The most striking thing I remember about him and his family is that he came with his twin brother, and he and his twin brother are markedly different in size. It was like meeting Mutt and Jeff.
Dr. Orloff came in and he looked at Joey and talked to Joey.
He's a very reassuring doctor. He's very calm. He knows what he's talking about. It felt really good to have an expert looking at him, because then we thought, we're almost to resolution now.
After hearing the litany of Joey's symptoms and the toll it's taking on the family, the first step Dr. Orloff takes is to prescribe a medication to treat Joey's excessive urination.
That in and of itself was a godsend. If we could get 5 hours of sleep a night, it was just like Yahoo.
I wanted to try and show them that we could make their life a little bit better. And at the same time, I introduced this concept that he may have something else going on.
And everything seemed to be going great until he started ultrasounding the kidneys. And in one of the ultrasounds, they noticed that something was wrong with the kidneys.
We therefore proceeded with a kidney biopsy, in which we take a small part of the kidney out, look at it under a microscope, and try and make a substantive diagnosis.
Just before we brought him in for the kidney biopsy, we thought he's losing his kidneys. We didn't know what was going on.
You filter about 40 gallons of water out of your bloodstream every day through the filtering apparatus of the kidney. His laboratory tests showed signs of the filtering not working correctly.
The biopsy shows that Joey's kidneys, which should be absorbing nutrients and filtering out toxins, aren't. Everything is just passing right through them. This is a condition known as Fanconi's syndrome. Fanconi's is not usually a diagnosis in and of itself, but rather an indicator of another, more serious disease.
I was a little concerned, and then I was relieved at the same time, because now they clearly knew at the microscopic level, what the problem was, or at least I thought they did.
So now it was important to try and look at all the possible causes for Fanconi syndrome. One of the major organs that, aside from the kidney, which seems to be the target organ of this disease, is the eye. So I sent him to the ophthalmologist.
We were frightened. Doesn't mean he's going to go blind. So then we were dealing kidneys and blindness. I didn't know. The head of ophthalmology looked in Joey's eyes and within a few minutes said, Joey has crystals in his eyes. And I go, he has what? He has crystals in his eyes.
Mike told Judy what Dr. Reiner had found.
My whole world just narrowed down to like this big. And it was just horrible, just absolutely horrible. The next thing I remember is being transferred to the room. And that was hard because now I see my mom, I see my brother, and I see my kids. I'm sorry.
The next day, Dr. Reiner came in to talk to Judy in person.
And he said, well, the bad news is you have cancer. He said, but the good news is that it's carcinoid cancer, and it's a slow-growing cancer. I cut it out. You had it in your small intestine. You had some metastasis to some lymph nodes. I yanked all those out.
Judy had struggled for 5 years to find out what was wrong with her. And now she knew. It was cancer. Though rare and slow-growing, the type of cancer that Judy has is still very dangerous. If left unchecked, carcinoid tumors can spread throughout the body. Dr. Reiner had operated just in time.
I felt, okay, all right, at least I know what the enemy is. And, I'm going to see somebody and I'm going to get a handle on this.
With her tumor removed, Judy went home to recuperate.
And I lost all 30 pounds within 2 weeks. And although I was weak and not feeling well, I could tell that I was gonna get through this and be better.
But Judy's gastroenterologist explained that she wasn't out of the woods yet. The road ahead would be filled with testing and waiting.
When you're diagnosed with cancer, you think, okay, well, what do I have to do? Chemotherapy, radiation, let's do it. When you're diagnosed with carcinoid, unless you actually have an active tumor where they can see it and they can deal with it, there's not a whole lot to do. It's like you have to sit back and wait for the tide to come in, and that's really frustrating.
There is a very good possibility that it is gone. It isn't going to come back. Judy eats right, exercises, does everything humanly possible.
I would say that her 10-year survival is probably in the 80% range. If she gets out to 10 years without disease, then her chances of going further than that become dramatically high.
The ophthalmologist immediately sends Mary back to Dr. Orloff.
And Dr. Orloff had us right in and proceeded to say, your son has cystinosis, this is what it is, this is what we have to do for him.
Cystinosis is a rare genetic disease in which the amino acid cysteine wreaks havoc on the body. In a healthy person, cysteine is gradually absorbed by the kidneys. But with cystinosis, the cysteine builds up and forms crystals, which can lodge in cells and damage tissue.
This is inherited. It's genetic. It comes from a recessive characteristic in the two parents.
The crystals tend to gravitate to the eyes, which causes a sensitivity to light. And the buildup of cysteine in the kidneys means that they can no longer absorb nutrients or water. This leads to excessive urination, which in turn leads to dehydration, low potassium, and a seemingly unquenchable thirst. The inability to absorb essential nutrients can also result in stunted growth, kidney failure, and ultimately death.
So these children typically will crave salt and water to a point that they won't drink almost anything else, and to the point of even keeping them from eating to get the adequate calories they need to grow.
I was so scared. I went home, went on the internet, and the information was very, very frightening. Talking about kidney transplants, they talked about people dying at a young age, and I cried. I think my husband and I cried all night long.
I remember when my sister told me what it was, I was scared. She didn't know what the future was going to hold for him.
Granted, it was not a good, happy diagnosis. At least we know what it is, and we know what we can do to make it better, or at least to make it less damaging than what it was.
There is no cure for cystinosis, but there are medications that can treat the symptoms and help prolong life. Dr. Orloff starts Joey on a drug to reduce the cystine content in his body, eye drops to remove cystine crystals in his eyes, and a growth hormone to help him catch up.
Before we understood the disease and could replace the missing chemicals, the children would die within several years. Now that we have the ability to treat the disease, they're living a much longer, healthier, and productive life.
By refusing to give up her quest for a diagnosis, Judy has greatly improved her odds for a healthy future. While doctors agree that the diagnostic process works most of the time, they also agree that medicine is not an exact science.
What I often tell patients when they come to me, that common things are common. I live in Manhattan, and I tell them if you hear hoofbeats in Central Park, it's probably a horse, not a zebra. So in patients such as Judith, her original doctors went and looked for what is common, because almost assuredly in their mind that's what they're dealing with.
But Judy is determined to change that attitude.
So I designed a pin, the awareness pin. We went with black and white because not all hoofbeats are horses, that sometimes it's a zebra. And the doctors need to listen and to look for the zebras.
The Jordans are lucky. Cystinosis is a difficult diagnosis to come by.
There are less than 2,000 people in the world with cystinosis. And that's not the first thing that jumps up at a doctor, because most doctors have never heard of it. Dr. Ernst was willing to go in and find out what was wrong. And it was our luck to find Dr. Orloff, who had treated cystonic children before.
You know, we're taught in medical school, common things are common, and you usually think of common things. So you have to be thinking outside the box to get to a rare diagnosis.
Thanks to proper treatment, today, Joey is thriving.
Between the various pills and these eye drops, which he only gets up once or twice a night now. And my son, who would not even go outside in the daylight because his eyes hurt, is now swimming in swimming pools and playing soccer and baseball and everything else.
He will need to take medicines for the rest of his life. Different types depending on where he is in his disease progression. And that eventually he will need to have a kidney transplant. Saying all that, he manages to do pretty well with life.
Joey is one of the toughest little boys I've ever met. Joey will do anything to just get on your nerves. He's like every other little brother.
Finally, the Jordans' sleepless nights have come to an end. And through it all, Mary and Rich have learned a valuable lesson.
You know something is wrong and you need to push forward and work on that.
Go to as many doctors as you need to go to get the diagnosis. And don't take no for an answer.